Your MRI says disc bulge or arthritis or degeneration. That does not automatically mean it's the reason your back hurts. Your MRI is information, but it is not the whole story. In this video, I'll explain what the scan can tell you, what it can't, and why you are not your MRI. An MRI is excellent at showing anatomy. It lets us look at the structures like the discs, the joints, the nerves, the ligaments, and the surrounding soft tissues. It can help identify things like disc bulges, disc herniations, spinal stenosis, arthritis, fractures, infections, tumors, and other conditions that may need medical attention. Those findings are important, especially when they match someone's symptoms and clinical exam. An MRI is a useful tool, not the entire diagnosis. Here's where things get interesting. An MRI cannot tell us whether a finding is actually causing your pain. Research has shown that many people with no back pain at all have disc bulges, arthritis, degenerative changes on an MRI. These findings can simply be part of normal aging, just like wrinkles or gray hair. Our spine changes over time. Those changes don't automatically equal pain. That's why we never look at an MRI report in isolation. We ask, does the finding match the person's symptoms? Does it match the physical examination? Does it explain how they're moving and functioning? Pain is far more complex than a picture on a screen. It's influenced by movement, strength, mobility, sleep, stress, activity levels, previous injuries, and even how sensitive the nervous system has become. That's why two people can have nearly identical MRI reports and completely different experiences. One has no pain, the other has significant symptoms. The MRI looks similar. The person does not. When I see someone with low back pain, I review imaging if it's available, but that's not where my evaluation stops. I'm also looking at how you move, what reproduces your symptoms, what makes you feel better, your hip and thoracic spine mobility, your hip and trunk strength, and how your symptoms can change over time. Low back pain is rarely explained by one image. It's usually multiple factors working together. If you've recently had an MRI and the report sounds scary, remember this. Your MRI describes your spine. It does not define your future. It doesn't tell us how strong you are, how well you can recover, or what you're capable of doing. The goal isn't to ignore imaging. It's to put it into proper context. We treat people, not MRI reports. If you appreciate me making this type of content, let me know by gently tapping that subscribe button. And if you're ready for change, book your free virtual back pain assessment using the link below. Together, we'll discuss your symptoms, review any imaging you've had, identify what's likely driving your pain, and create a clear path for what's next. You don't have to do this alone.